When a father lost his only son, he channeled his pain into helping other young adults find a cure for the extremely rare cancer. I'm Taylor Torgano in Long Beach with the first of its kind research happening in the lab just inside these doors. Stopping for coffee, Tom Stockwell takes a second to reminisce. This picture of his son, Robert, was taken the day he officiated his sister's wedding. Tom says it's the perfect example of the 20-year-old's character. Strong for everyone, but behind this smile, Robert was actually in a lot of pain.
3 hours before that picture, he was throwing up and sicker than a dog. And you look at him there, and he looks as great as can be.
Just 6 months later, Robert died from fibrolamellar hepatocellular cancer, an extremely rare disease with no treatment that had been attacking Robert's once healthy liver for about 3.5 years. Tom remembers that dreaded day in January when Robert was diagnosed with something even the doctors were unfamiliar with. But he says the hardest part was seeing Robert suffer in those final months.
He'd ask me, he'd say, "Daddy, how long do I have?" And I'd always tell him, "Well, we have today. We have today, and that's the day that matters."
It was during those last days that Tom promised his son he would keep fighting this war against fibrolamellar cancer, even if Robert lost the battle. He gave up his career in retail and set out on a new journey with his wife, starting the Fibro Fighters Cancer Foundation that has since brought together more than 300 patients around the world. The idea is to educate and connect those families to the countless clinicians and researchers Tom now works with to find a treatment, like medical and laboratory director Dr. Robert Nagourney.
I was aware of fibrolamellar carcinoma because it is a rare variant. And when you're a medical oncologist, you very occasionally will come across a case. Most of these cases are in young people.
This laboratory is where Dr. Nagourney says he pioneered the use of living human cancer cells to find the most effective and least toxic treatment option for each individual cancer patient.
Discoveries made here using this platform have gone on to change the way cancer is treated.
His lab techs are using a technique that measures how cancer cells respond when exposed to a variety of drugs and drug combinations. They find treatments for several different cancers, and now they're testing fibrolamellar patients from Tom's network.
These diseases like hepatocellular cancer, particularly fibrolamellar, are virtually unresponsive to treatment. If we don't find something new, they won't have anything to take. So our job is to explore unthought of directions, angles, combinations, treatments, sequences for one of the most difficult to treat cancers.
It's new hope for the father who says any bit of progress helps mend his broken heart.
If I can help one other young man or young woman, it's okay. It'll be okay.
Turning pain into passion to give a fighting chance for the next dad's special son.